think some of the current myths or questions about hair restoration include what size grafts a person needs. There's great debate about micro and mini versus follicular unit extractions, and there are a variety of techniques available. In some ways, those don't matter too much. Whether your graft is 0.7 millimeters or 1.0 millimeters, in the end, doesn't necessarily translate into excellence of results. I think there are a few steps, though, that do translate into excellent results. One is proper planning. Every patient has a different hair pattern at a different age, and all of those things need to be considered when planning for a hairline, especially for 10, 20, 30 years into the future. It's easy to make a person's hair look good for the next 2 years, but how it's going to look over the next 10 to 20 years is a much bigger challenge, and that's what we really try to emphasize here is a long-term plan. We want our patients to be happy for many years to come, and again, that really comes from thoughtful planning. Having said that, the other important aspect is being judicious in the use of your resource, namely your hair. We want to maximize where we use your hairs to really get the best coverage that we can and not overuse the hairs that you do have, with the understanding that you might need another procedure sometime in the future. So it's really balancing what's there and what your needs are. Of course, technique does matter. We do take great care to treat each of the grafts that we harvest very tenderly so as not to lose any of those grafts. They're a valuable resource, and in the end, they are what's critical to providing a great result. So again, it's through thoughtful planning, through preparation, through appropriate use of the grafts that really, in the end, provide a great result. And of course, combining that with making sure a patient is informed both before their treatment and has a lot of support after their treatment are also real paramount to make sure you have a great experience with us here.